Growing concerns about the deadly coronavirus.
On January 20th, 2020, the CDC confirmed the first case of COVID-19 in Washington state. Only a few months later, the World Health Organization informed the public that the virus was to be officially considered a pandemic. By April 15, 2020, the cases of COVID-19 jumped to nearly 2 million. By the end of the month, most states began requiring masks in all public areas. Hospitals became overcrowded and required many workers to stay overtime to take care of the many in need.
We're looking at shutdowns. I've said I'm going to protect the health of New Yorkers.
Nationally, caseloads are only a fraction of what we saw in the winter.
Right now, the mayor here in New York City.
In the beginning of the pandemic, millions of people lost their jobs and struggled to afford essential items due to businesses closing or going out of business because of the hardships brought on by the virus. The unemployment rate dropped to a level that hadn't been seen in decades, leaving many without homes, food, or proper medical care.
Stimulus package to address this, likely more than $1 trillion with direct payments to Americans. And the virus now in all 50 states. There are now more than 6,400 cases in the U.S. That number is going to skyrocket as more tests take place. So far, 108 deaths.
We're going to talk live to an emergency room.
We have been evicted for 19 days in the pandemic. So we've been living homeless since.
Your socks wet? Okay. I don't know, I just put it some type of way where I just actually be enough comfortable where I feel like I'm in the bed or something.
When I wake up in the morning, I'm sitting in the front seat of my car. Realization sets in, okay, we've been out here all night long. It don't have to be like that. We tried our best to do our part, and
shoppers have been packing into stores to stock up on essentials over fears of the coronavirus, and because of that, many stores are experiencing supply shortages on hand sanitizer and now toilet paper. People have been buying so much of it, Kroger is now limiting how much customers can buy, while other big box stores struggle to keep store shelves stocked.
As people began preparing for what was to come, stores began to run low on supplies with a widespread shortage of toilet paper, shelf-stable foods, bottled water, disinfectants, and more.
All the patients in this room, all the feet that you see, they all have COVID.
As the demand for care became greater during the pandemic, hospitals faced shortages of beds and staff across the country, which led to many who could not afford private care without proper treatment.
We are right now scrambling to try to get a few additional ventilators or even CPAP machines. If we could get CPAP machines, we could free up ventilators for patients who need them.
New video from inside Kaiser Permanente's Downey and Fontana Medical Centers shows the stark reality of the current COVID surge and the impact it's having on hospitals. You can see COVID patients lined up in beds and hallways, and even more patients waiting outside, hooked up to oxygen tanks under tents.
Lines across the United States remain in a state of high tension tonight as the country braces itself for another wave of protests over the death of
On May 25, 2020, George Floyd was tragically murdered by police. The death of George incited anger across the country, and in the midst of the pandemic, streets became filled with people there to protest for justice for George Floyd. In some cities, looting and violence erupted, leaving people injured and properties damaged.
Another night of chaos and unrest as anger over police killings spread to every corner of the country. Penetrating the heart of political power in Washington, D.C., security agents used tear gas to push protesters away from the White House. New York's iconic streets were littered with the debris of rage over the death of George Floyd, but also giving vent to years of festering frustration with police mistreatment of African Americans. Here and in...
During a time where most people feared contracting the virus, millions of people across the country came together to fight against police brutality and racism, as well as to fight for the justice of George Floyd.
Police for racists! Police for racists! Black Lives Matter! Black Lives Matter!
Amidst the pandemic, our focus was drawn to racial injustices in our society, injustices that contributed to the coronavirus disproportionately impacting people of color.
This disease has really pulled back the curtain on some very startling and troubling disparities that we see.
While we face this...
In the new year of 2020, it was announced that a virus called COVID-19 had spread to the United States. Within the span of 2 weeks, schools, restaurants, corporations, etc. began to shut down because of how fast the disease was spreading. The world became filled with fear and uncertainty, unsure of what was to come in the near future. Businesses across the nation began to close down, leaving many jobless and without homes. Ultimately, the pandemic highlighted the disparities within the medical care system, as well as the racial injustices that continue to affect the lives of many in the United States today.